So after the discussion of different companies who are service organization or business organization, manufacturing organization, today after this particular topic we are reaching towards the case study on service design. Basically how we design the services or different organization, how they properly design a service. There is a proper, we can say, they follow the metrics as we have discussed the service metrics in last session. Sarvakwal model they are using, or we can say, let's read about how we can say how they design their services, their case study on service design. So there is a health plus clinics service design. Let's introduce what are the introduction. Health plus clinic is a chain of healthcare centers offering a range of services including general practice, specialist consultations, diagnostic test, and wellness program. So, Health Plus is a kind of, we can say, a service center who is providing different health services, and these health services are general practices, specialist doctors are, we can say, we are providing, or the company is providing different diagnostic tests they are providing, and different wellness program also. Despite their broad services offering, patient satisfaction and operation efficiency were not meeting expectation. Because it is a case study we are reading, so there are some kind of problems arises in the service design of Health Plus. Okay, so we will discuss what kind of problems arises in service designs and how they will remove that kind of problems after the different researches. To address these challenges, Health Plus clinics embarked on a service design project. How they designed their project and what kind of problems arises, let's read in the case study. So basic, the objective of Health Plus is improve patient experience and satisfaction, enhance operational efficiency, reduce waiting times, and increase staff engagement and productivity. These are some objectives that follows by the Health Plus organization. So basic number one is improve patient experiences and satisfaction. It means patient reach to that particular organization to take to avail the services, and that is also a very big experience they gain, either the services are good or not. Okay, we can say the doctors the company are providing the doctors, are they discussing with the patient in an efficient manner or not. The problem, we can say, the patient is satisfied or not. Okay, so that is also a very big, we can say, the objective of this concern. Enhance operational efficiency means here the company is properly, we can say, design the operations. Okay, where is the OPD, where is the different chambers, where is diagnostic labs, or different functions of that particular organization. It works for reducing waiting time, because there are number of patients are reaching. So waiting time, they has to minimize the waiting time. It means a person who is reaching that particular organization, the number of that patient is at what time they, we can say, interact with doctor, or the operational functions are, we can say, delay, or we can say the attenders are not there, so that create the waiting times, that can enhance the waiting time. So how we can reduce the waiting times? Okay, next is increase staff engagement and productivity. Obviously staff engagement with the patient is also very necessary. A person reached to the reception, and there is a no any person over there, so the patient will feel unsatisfied or dissatisfied. Okay, next is what and the productivity. Now in the research phase, different methods are using. Number one is stakeholder interview. Here, conducted with patient, healthcare providers, administrative staff, and management. They will take a proper interview of patient. Okay, how to deal with the patient, or how the service provider will interact to the customers. Administrative staff is effective or not. So all the person are involved, all the stakeholder holders are involved in each and every process of that particular organization. Next is survey, distributed to a large patient population to gather quantitative data. Here they we can say the population is patient. Okay, so a larger patient population reach to that particular place, so we can take the survey, or we can take the feedback of the particular organization, that services are good or not. Next is say observational studies, analyzed patient flow and services delivery in clinics. So the actual patient are flowing, reaching to the particular organization or not, service delivery is good to the clinics or not. So this is a observational study. Next is journey mapping. Journey mapping means created delayed journey maps for different types of patients. Here they will create a proper journey map. Okay, suppose a person is not fit. Okay, he is injured. So we can say there is some kind of problem in their legs and hands. Okay, or this is abnormal patient. So what we do, we have to provide some different kind of journey map also. So what we found and what are the findings, that is patient pain points. It means long waiting times, complex appointment bookings process, and lack of personalized care. So these are the findings which we found from the survey, that patients are waiting for a long period over there to meet the doctors. Okay, next is complex appointment and booking process. When they are booking to their places, the process is very slow. And there is a lack of personalized care. Every person need a proper we can say attention. Every patient need attention. If there is no attention towards the customers or patients, so that can create the problem, or that is a finding. Next is staff pain points. Staff pain points means overburden administrative staff, if inefficient workflow and communication gap. If there are number of patients are reaching, but the attenders are lack, or we can say there are less number of administrative staff, less number of workers, if inefficient working, so that can create also a problem. So this is also a finding. Next is operational bottlenecks. Operational bottlenecks means inconsistent process across different clinics, outdated technologies, and resource misallocations. It means there is some kind of bottleneck, or we can say the barriers in between the operations. So how we can remove these barriers? So these are some findings on that the company will work. Now, after the survey, the company reached towards the solution, that how can we find out the solution of that particular problem, and how we can efficiently solve the problems which is arising. Number one, digital transformation. It is very we can say mandatory in each and every organization, that a company is company will provide a digital technologies or digital bookings of patients, or proper we can say websites through which person can approach. Implement an integral digital platform for appointment bookings, patient record, and communication, so that patient generally reach to the website and they can easily check their own data. So there should be a user-friendly websites, or a digital transformation is must in this case. Next is streamlined processes. Streamlined processes means in standardized process across all clinics to reach consistency and efficiently. It means there should be some streamline so that a patient cannot confuse where he want to go, where he want to reach. There should be proper mapping of each and everything, and streamlined things should be mandatory in the organization. Next is patient-centered design. Patient-centered design means redesign clinic layouts to enhance patient flow and comfort. There should be, if the person is waiting to meet the doctor, the place where he is sitting should be comfort, or so that he can stay for a long time if he is waiting, or we can say the clinic layout should be properly designed. It can also attract the customers. It can also a very big point for we can say to find out the solutions. Okay, next is staff training and engagement. To develop training programs focused on new technologies and patient-centered care. It is very mandatory that at time to time we can train our staff, or a company can train their staff as per the requirement or as per the latest technologies. Now, next point is design and prototyping. What he has to do and what kind of things a company should implement in their organization. Number one is digital platform. As we know that a platform has to be provided by the company, that can be a user-friendly app or web portal on which a patient will reach and book their appointment as per their requirement or as per their convenience. Okay, access to medical record and direct communication with the healthcare providers. Next is clinical layout. Clinical layout means new floor plans to reduce congestions and create a more welcoming environment. Next is staff tools. Staff tools means tools and dashboards to help staff manage patients flow and administrative tasks more efficiently. Staff tools or dashboards should be effective. This is our design and prototyping. Now, after the testing or survey, what we found or how to test these particular, we can say the samples which we have taken from the population, conducted pilot test in 3 clinics. Okay. Next, pilot test means we are checking our data or we are checking our questionnaire, which we are going to fill in or distributed among the patients. Okay, next is gathered feedback through survey and direct observation. Here we are taking, we can say the feedbacks. Okay, and we are directing a direct observation we are taking. You can easily take the feedback directly to the customers or patients. Next is iterated design based on real world usage and feedback. Here we can create the design as per the real world, or we can say that feedbacks. Next is how they implement these things. Phases rollouts, pilot clinics, training programs and full rollouts. Pilot clinics means refine based on feedback from initial test. Training programs, we know that how to provide the training to the staff. Next is full rollout, any gradual implementation across all the clinics. After this, how we monitor and evaluate the things. Continue feedback loops with patient and staff. There would be a connection between patient and staff. And after they reaching towards your website, that kind of some kind of bond created between the customer and service provider. Next is regular review meeting to access process and makes necessary adjustment. As per the reviews, a person or a organization, there is a duty of the organization that how they will do the adjustments and how they remove the problems arising by the patients. Next is key performance indicators. What are these? These patient satisfaction scores, waiting times, operational cost and staff engagement levels. Through the indicators, we can easily find out that how we can solve the problems. Okay, next is outcomes. What kind of outcomes comes? Patient satisfaction increase 30% after this survey. Operational efficiency, administrative tasks streamlined or reducing workloads. Next is staff engagement. Staff engagement will, we can say, that will higher morale and productivity. After the survey, we found that how can we easily solved out the problems which arising in the proper, we can say, in the findings. Okay, now after the research we found the outcomes. Staff engagement ho gaya. Next is financial performance. Financial performance means how we can reduce the operational cost. Overall operational cost, we have to reduce these costs so that we can easily provide best to best services to the patients. And next, reach towards the conclusion. After this case study, what we found, first of all, we our objectives are reaching or not. Have we fulfilled our objectives or not? The main concern of each and every organization is to fulfill their objectives. So the conclusion is the service design projects at Health Plus Clinic successfully address the initial challenges and resulting in significant improvement in patient experiences, operational efficiency and staff engagement. The project demonstrated the value of a holistic, user-centered approach in transforming healthcare. So this is the overall case study. If we can say there is a case study you have or you are reading, then how can we reach towards the conclusion and what we found the we can say how we write a case study of your organization and how we can solve these case studies. So as we know that in chapter 1 we read many topics of production and operation management. I hope the session will be very beneficial for you, and I hope for your next section I will meet you with the next section. Until then, bye bye, take care.